My name is Rita Luongo, and I am the Development Director for Thayer County Health Services. The foundation basically has one goal and one goal only, and that is financially fundraise to support the hospital in its mission to provide exceptional health care to the residents of Thayer County and surrounding communities. The foundation is important because the hospital, Thayer County Health Services, is a county nonprofit hospital. It's a critical access hospital, which means that basically to be able to continue to get the latest and most modern medical equipment, that's where the foundation comes in, because they are able to fundraise and get support from the local communities to allow the hospital to continue to have modern medical equipment to do their mission. By being a part of two capital campaigns that help complete two building projects for the hospital, I was able to see the impact that some of the work that I do has, and how it has hopefully made not only Hebron but all of Thayer County a better place for people to want to live and raise their families. So the new beds are replacing beds that were purchased in like about 2008. A lot of the features on them weren't always reliable. It just became apparent that they needed to be replaced. So in conversations with the hospital leadership, we got quotes on the new beds. We had the hospital gala coming up. We had the first Thayer County Big Give. Plus we do like an employee giving campaign, and we kind of made a decision with the foundation board that those three main fundraisers that the foundation does towards the last 3 months of the year would be targeting being able to buy new patient beds. At the time when we got the quotes, the beds were between $12,000 and $13,000 a piece. By the time the end of the year rolled around, when we actually had funds to buy the beds, the price had gone up to about between $15,000 and $16,000. All in all, the foundation was able to fundraise through those events to purchase 5 of the patient beds. The Hospital Guild pledged that they would give funds for 1 patient bed, and then in the capital budget for the hospital, they contributed for 1 bed. So all that together meant that we could purchase 7 new patient beds. The new beds are really nice. I think our patients are going to see firsthand that, there's a lot of features on there that make it safer for patients. It's also going to be safer for our nurses because, there's a lot of features that help them turn a patient, to prevent bed sores and stuff, so that they aren't having to lift the patient that, sometimes can injure an employee. The impact of it just shows, what a community can do when they all come together, because this wasn't the foundation. It wasn't like our board members wrote a check for these beds. It was the community supporting the different fundraisers that the foundation had going on, and them realizing the importance of keeping these patient beds more modern. It's not Rita raised the money, it's not the foundation raised the money, it is the community raised the money for these beds.
My name is Renee Vorderstrass. I'm the hospital nursing supervisor at Thayer County Health Services. For patients that are maybe high fall risks, the bed alarms will be nice to help the staff know that the patient is getting up and we can prevent falls. The patients are going to love the cell phone holder and charger. I think that's going to be a good one. I kind of joked that that might be where you find the nurses is charging their phones on our beds too, potentially. I think the beds will help the patient stay just because the beds are going to be much more comfortable. It will help with their satisfaction. And again, it will help with their safety. If they're high fall risk, it's going to alarm us and let us know that the patient is getting up. We're just very, very grateful to get these donations. It's humbling to know that the community is going to provide what we need. We have something that we need for our patients and they support us, and it's just a great thing for our community. Thank you so much for your donation. I think that this is going to make a huge impact on our patients.